Untreated diabetes can lead to severe and often irreversible damage in multiple areas of the body, affecting nearly every organ system over time. The prolonged effects of unmanaged blood sugar levels are especially damaging to the cardiovascular system, nerves, kidneys, eyes, and feet, leading to complications that can significantly impact a person's quality of life. Initially, diabetes may present with subtle symptoms or none at all, making it easy to overlook. However, as glucose remains elevated in the bloodstream, it begins to disrupt bodily functions, accelerating wear on vital organs and gradually diminishing the body's ability to repair itself. When blood glucose is chronically high, the heart and blood vessels are among the first to be affected. Excess sugar in the blood makes the vessels stiff and narrow, reducing the flow of blood throughout the body. Over time, this creates a vicious cycle in which the heart has to work harder to pump blood, increasing the risk of high blood pressure, which further harms the vessel walls. This combination of high blood sugar and high blood pressure is extremely dangerous, leading to an increased risk of heart disease, heart attacks, and strokes. Additionally, high cholesterol levels, common in diabetes, exacerbate this issue by contributing to the buildup of plaque in the arteries, restricting blood flow even more and raising the risk of a heart attack. Many people with untreated diabetes also develop peripheral artery disease, which is a narrowing of the blood vessels in the legs and feet that leads to pain and mobility issues. Cardiovascular complications are one of the most common causes of mortality in untreated diabetes, underlining the need for early intervention and consistent management. Untreated diabetes also damages the peripheral nerves, leading to a condition called diabetic neuropathy. This nerve damage is primarily due to poor blood circulation to the extremities, as well as to the direct toxicity of high glucose levels on the nerve cells. Over time, neuropathy causes severe discomfort in the hands and feet, manifesting as numbness, tingling, burning, and pain. As the nerve damage progresses, the feeling in the affected areas may decrease, making it difficult for individuals to sense injuries or infections. The implications of this are serious. A person may sustain injuries that go unnoticed and untreated, increasing the risk of infections and even the possibility of amputations. For some, diabetic neuropathy affects not only the peripheral nerves but also the autonomic nerves, which control vital functions such as heart rate, blood pressure, and digestion. Autonomic neuropathy can disrupt these functions, leading to issues like blood pressure instability, digestive problems, and even sudden drops in blood sugar that can result in dangerous hypoglycemia. Living with untreated neuropathy is challenging, with the pain and loss of function significantly impacting day-to-day life. In addition to cardiovascular and nerve complications, untreated diabetes places a considerable strain on the kidneys, often leading to diabetic nephropathy. The kidneys filter waste from the blood, and prolonged exposure to high blood sugar levels damages the tiny blood vessels that make this filtration possible. As the kidney cells sustain more damage, the kidneys begin to leak protein into the urine, a hallmark sign of diabetic kidney disease. In the early stages, this protein leakage can be minimal, often undetected without testing. However, as kidney function declines, waste products start to accumulate in the blood, leading to a range of symptoms including fatigue, swelling in the extremities, and difficulty concentrating. Eventually, untreated diabetic nephropathy can progress to kidney failure, requiring dialysis or a kidney transplant. Dialysis is a grueling process that demands considerable time and effort from patients, often requiring them to go to a clinic multiple times a week for hours-long treatments. Preventing diabetic nephropathy is one of the most compelling reasons to address diabetes early, as once the kidneys are severely damaged, there is little that can be done to restore their function. One of the more well-known complications of untreated diabetes involves vision, specifically through a condition known as diabetic retinopathy. High blood sugar levels can damage the blood vessels in the retina, the part of the eye responsible for detecting light and sending signals to the brain. This damage occurs gradually, as weakened blood vessels in the retina begin to swell and leak, or even close off completely, impairing the retina's ability to function properly. In some cases, new, abnormal blood vessels may grow on the retina, which can also leak and cause further complications, including scarring and retinal detachment. The initial stages of diabetic retinopathy may not present any noticeable symptoms, which is why many individuals may not seek help until the damage has already advanced. Over time, untreated diabetic retinopathy leads to blurriness, dark areas in vision, and eventually blindness. In addition to retinopathy, diabetes also increases the risk of developing other eye diseases, including cataracts and glaucoma, both of which can significantly impair vision. These eye complications underscore the importance of regular eye examinations for individuals with diabetes to catch signs of retinopathy early before it leads to irreversible vision loss. The feet are another area heavily impacted by untreated diabetes, primarily due to the dual issues of poor blood circulation and nerve damage. Reduced blood flow to the feet means that wounds or cuts do not heal as quickly or as effectively, creating a perfect environment for infections to take root. Compounded by diabetic neuropathy, which dulls sensation in the feet, many individuals may not feel cuts, blisters, or other minor injuries. Left untreated, these minor injuries can escalate into serious infections, sometimes requiring surgical intervention. In severe cases, these infections may become gangrenous, resulting in amputations. Additionally, foot deformities can develop as a result of neuropathy, further complicating a person's ability to move and increasing the likelihood of injuries. Proper foot care and regular checkups are crucial for those with diabetes to avoid these outcomes, as the impact on mobility and independence from foot complications can drastically alter a person's quality of life. In summary, untreated diabetes is a condition that gradually compromises the body, damaging the cardiovascular system, nerves, kidneys, eyes, and feet. The effects are severe and progressive, often leading to life-threatening complications and significant decreases in quality of life. However, each of these complications can often be mitigated or even prevented through proactive management, early detection, and consistent care. When diabetes remains untreated, the toll on the body accumulates over the years, and reversing the damage becomes increasingly difficult. As awareness of diabetes grows, so does the understanding that it is not merely a blood sugar issue but a complex, systemic condition with far-reaching consequences. This underscores the importance of early detection, consistent monitoring, and diligent treatment to avoid the devastating long-term effects that untreated diabetes can bring. The long-term consequences of untreated diabetes are complex and far-reaching, with detrimental effects that extend to nearly every bodily system. Beyond the widely recognized complications involving the cardiovascular system, nerves, kidneys, eyes, and feet, untreated diabetes can lead to serious damage in additional areas, including mental health, digestive health, sexual function, oral health, and immune system response. The longer diabetes goes untreated, the greater the risks of developing severe complications that disrupt daily life and potentially shorten lifespan. One of the less commonly discussed consequences of untreated diabetes is its impact on mental health. Chronic high blood sugar levels affect the brain's chemical balance, leading to increased risks of depression, anxiety, and even cognitive decline. For many, managing diabetes involves lifestyle changes, frequent medical appointments, and ongoing monitoring of blood sugar, all of which can create emotional stress and a sense of being overwhelmed. However, when diabetes goes unmanaged, this stress may become more profound, as physical complications lead to chronic pain, reduced mobility, and a gradual loss of independence. These effects contribute to a cycle where mental health symptoms like anxiety and depression make managing diabetes even more challenging, creating a feedback loop that exacerbates both physical and mental health symptoms. Additionally, research has shown that high blood sugar levels can directly impact brain function, leading to cognitive impairment and an increased risk of conditions like Alzheimer's disease. This effect, often called diabetes-related cognitive decline, underscores the importance of mental health support and cognitive assessments in individuals with diabetes. Diabetes also has a significant impact on digestive health when untreated, often leading to a condition known as gastroparesis. Gastroparesis is a disorder that affects the normal movement of the stomach muscles, slowing or even stopping the emptying of food from the stomach into the intestines. High blood sugar levels damage the vagus nerve, which controls stomach muscles, leading to nausea, vomiting, bloating, and severe abdominal discomfort. People with gastroparesis often experience unpredictable blood sugar levels because their food digestion is delayed, making it challenging to maintain stable blood glucose. Additionally, untreated diabetes increases the risk of developing other digestive issues such as acid reflux, irritable bowel syndrome, IBS, and non-alcoholic fatty liver disease, NAFLD. The cumulative effect of these digestive problems can severely impact a person's quality of life, making it difficult to maintain adequate nutrition, manage weight, and control blood sugar levels, further exacerbating the progression of diabetes-related complications. Untreated diabetes can also disrupt sexual and reproductive health. For men, high blood sugar levels damage the blood vessels and nerves needed for an erection, leading to an increased risk of erectile dysfunction, ED. Diabetes is one of the most common causes of ED, as damaged nerves and impaired circulation make it difficult to achieve and maintain an erection. Women with untreated diabetes may experience sexual health issues as well, including decreased libido, vaginal dryness, and increased risk of infections such as yeast infections and urinary tract infections, UTIs. Additionally, untreated diabetes can complicate pregnancy, increasing the risk of complications for both mother and baby. High blood sugar levels during pregnancy can lead to a condition called gestational diabetes, which, if untreated, can cause preeclampsia, premature birth, and higher birth weights, potentially leading to delivery complications. These risks highlight the importance of managing blood sugar levels to preserve sexual health and support reproductive wellness, as untreated diabetes can have profound effects on intimate relationships and reproductive outcomes. Oral health is another area significantly affected by untreated diabetes. High blood sugar levels increase the risk of developing periodontal disease, a serious gum infection that damages the soft tissue and destroys the bone supporting the teeth. Diabetic individuals are more susceptible to infections, and high blood glucose fosters an environment where harmful bacteria can thrive, exacerbating gum disease. In untreated diabetes, gum disease can progress more quickly and become more severe, leading to pain, chewing difficulties, and eventually tooth loss. Moreover, people with untreated diabetes often experience dry mouth, which not only makes eating uncomfortable but also increases the risk of cavities and infections. Persistent dry mouth creates an ideal environment for bacteria to grow, resulting in a higher risk of developing oral thrush, a fungal infection. These oral health complications are particularly distressing as they affect basic functions like eating and speaking and can lead to further health complications if bacteria from the mouth enter the bloodstream. Lastly, untreated diabetes compromises the immune system, making the body more susceptible to infections and prolonging recovery times. Chronically high blood sugar weakens immune cell functions, diminishing the body's ability to respond to and fight infections effectively. This impairment increases the risk of common infections like respiratory infections, urinary tract infections, and skin infections, which can be more severe and harder to treat in diabetic individuals. Diabetic foot infections, a common problem, often become life-threatening if left untreated due to the body's weakened ability to heal and fight infection. Additionally, people with untreated diabetes are more likely to develop severe complications from viral infections like the flu or COVID-19, as their immune response is slower and less effective. Furthermore, high blood glucose levels create an environment that favors bacterial and fungal growth, making diabetic individuals more susceptible to infections that would otherwise be easily managed by a healthy immune system. This increased risk of infections not only affects day-to-day health but also underscores the heightened need for preventive care, such as vaccinations and wound care, to mitigate the effects of a weakened immune system. The multifaceted effects of untreated diabetes are devastating and far-reaching, gradually diminishing quality of life and leading to severe, often irreversible health complications. From mental health challenges to the immune system's diminished capacity, each area affected by untreated diabetes contributes to a cumulative burden that can be overwhelming. These consequences emphasize the importance of early detection, continuous monitoring, and comprehensive management of diabetes, as untreated diabetes significantly shortens life expectancy and impairs well-being. Comprehensive diabetes care can help avoid these severe complications, allowing individuals to lead healthier, fuller lives and preventing the cascade of health issues that untreated diabetes ultimately brings.